Valsartan hard capsules are a medication used primarily to treat high blood pressure, hypertension, and heart failure. Valsartan belongs to a class of drugs known as angiotensin II receptor blockers ARBs, which work by blocking the action of angiotensin II, a hormone that constricts blood vessels and increases blood pressure. These capsules are formulated as a convenient oral dosage form, making them easy to swallow and suitable for daily use. Valsartan hard capsules are available in various strengths, allowing for individualized dosing based on patient needs and the severity of the condition being treated. Valsartan is often prescribed alone or in combination with other antihypertensive medications to lower blood pressure and reduce the risk of cardiovascular events such as heart attack and stroke. It is also used in the management of heart failure to improve symptoms and increase survival rates. Common side effects of Valsartan hard capsules may include dizziness, headache, fatigue, and nausea. More serious side effects are rare but may include kidney problems, hyperkalemia, high potassium levels, and allergic reactions. As with any medication, Valsartan hard capsules should be used under the guidance of a healthcare professional who can assess individual patient needs and monitor for potential side effects. It's important for patients to follow the prescribed dosage and to report any concerns or changes in symptoms to their healthcare provider while taking Valsartan.